Have you ever heard of a surgery with a 300% mortality rate? It sounds impossible, right? Like something out of a horror movie. How can one operation result in 3 deaths? But today, we're diving into one of the most bizarre and infamous stories in medical history. A tale that perfectly captures the brutal, high-stakes world of 19th century surgery. This is the story of Dr. Robert Liston, and the operation that went spectacularly, tragically wrong. Before we get to the main event, let's set the scene. Picture a world without anesthesia. Imagine needing surgery, knowing you'd be wide awake, feeling every single slice, every saw through the bone. In the early 1800s, this was the terrifying reality. The operating theatre wasn't a sterile, quiet room. It was a theatre in the truest sense. Crowds of students and onlookers would gather in tiered seating to watch the gruesome spectacle unfold. For the patient, it was an unimaginable ordeal. For the surgeon, the most valuable skill wasn't precision. It was speed. The faster the surgery, the less time the patient had to endure the agony, and the lower the chance of them dying from shock, right there on the table. And in the world of speedy surgery, one man was the undisputed king, Dr. Robert Liston. Born in Scotland in 1794, Liston was a giant of a man, standing at 6'2". He was known for his immense strength, his swagger, and his almost unbelievable quickness with a knife. He was the fastest knife in the West End, a surgical superstar. While other surgeons might take half an hour to amputate a limb, Liston could do it in under 3 minutes. Some accounts say he could get it done in as little as 28 seconds. He would stride into the operating theatre, often dressed in his blood-stained apron, and bellow to the packed gallery, "Tie me, gentlemen, tie me." With his assistant holding the patient down, Liston would go to work. In a flash of steel, the limb would be off, the wound cauterized, and the patient stitched up before they could fully process the horror of what just happened. His speed saved lives. In an era where post-operative infection was rampant and shock was a major killer, getting the patient off the table quickly was paramount. Liston's mortality rate for amputations was about 1 in 10, which was astonishingly low compared to the 1 in 4 rate at other London hospitals. He was a pioneer, inventing tools like the Liston knife, which is still used in some form today. He was brilliant, he was bold, and he was very, very fast. But sometimes speed comes at a cost. This brings us to the day of the infamous operation. The patient was on the table, needing a leg amputation. The theatre at University College Hospital was packed, as usual, with eager students ready to witness the master at work. Liston, in his typical dramatic fashion, prepared his instruments. "Tie me, gentlemen," he lightly declared. He grabbed his knife and began. He moved with such furious speed, such a whirlwind of motion, that his focus on the patient's leg was absolute, perhaps to the detriment of everything else around him. As he sliced through the flesh and bone of the patient's leg, his assistant was busy trying to hold the thrashing patient still. In his haste, Liston's flashing knife didn't just cut the patient. He accidentally sliced off 2 of his young assistant's fingers. The assistant, understandably, shrieked in pain and shock. But Liston didn't stop. He was a man on a mission, against the clock. He finished the amputation in his record time, under 2.5 minutes. He tossed the severed leg aside and swung his bloody knife back. Now, this is where the story goes from a surgical mishap to a legend of medical disaster. In that backswing, the tip of his knife allegedly grazed the coat of a distinguished spectator who was watching a little too closely. The man, seeing the blood-soaked knife coming at him, and perhaps feeling the slight nick, was so terrified he believed he had been fatally stabbed. The shock was too much for his system, and he dropped dead from a heart attack right there in the gallery. One death. Meanwhile, back on the operating table, things were not going well for the other two victims of Liston's speed. The patient, whose leg had just been amputated, was moved to the recovery ward. In the 19th century, the concept of germ theory wasn't understood. Surgical instruments were rarely cleaned between operations, and surgeons often operated in their street clothes. Unsurprisingly, the patient's wound became infected, likely with gangrene, and he died a few days later. That's death number 2. And what about the poor assistant who lost his fingers? His wound also became infected. Remember, Liston's knife had just been through a diseased leg. With no antibiotics, the infection spread rapidly through the assistant's hand and arm. A few days later, he too succumbed to gangrene and died. Death number 3. 1 surgery, 1 patient, 1 assistant, 1 spectator. 3 deaths, a 300% mortality rate. It's the only known surgery in history to have achieved such a grim statistic. Now, it's important to add a historical footnote. While this story is widely told and accepted as part of Liston's legend, some historians question the details. The story primarily comes from the writings of Richard Gordon, a doctor and author from the 20th century. While Gordon was a reputable source, concrete, contemporary documentation of all 3 deaths from that single operation is hard to find. It's possible the story was embellished over time, combining elements of different chaotic surgeries into one ultimate cautionary tale. Whether every single detail is 100% accurate or not, the story persists because it so perfectly illustrates the brutal reality of pre-anesthetic surgery. It highlights the trade-off between speed and safety, and the sheer chaos of the old operating theatres. Ironically, despite this infamous case, Robert Liston was on the right side of history. He was not just a showman. He was genuinely dedicated to improving surgical outcomes. And just 7 months after his most disastrous surgery, in December of 1846, Liston would perform another, far more important operation. This time, it would be the first major surgery in Europe performed with modern anesthesia. He amputated a butler's leg using ether. The patient, instead of screaming in agony, was unconscious. When he woke up, he asked when the procedure was going to begin. Liston replied, "It is all over. The era of time, gentlemen, was coming to an end. The age of painless surgery had begun, and Liston himself had helped usher it in." Sadly, Liston wouldn't live long to see the full impact of his pioneering work. He died just a year later, in 1847, from a ruptured aneurysm. But he left behind a complex legacy. He was a flawed, arrogant, and sometimes reckless figure. But he was also a brilliant innovator, who saved countless lives with his skill and who played a key role in one of the most important medical advancements in human history. The story of his 300% mortality rate surgery serves as a stark, unforgettable reminder of how far medicine has come. The next time you think about surgery, be grateful for the quiet, sterile rooms, the meticulous procedures, and most of all, the blessed relief of anesthesia. We owe it all to the lessons learned from the wild, bloody days of surgeons like Robert Liston. Thanks for watching. If you found this slice of medical history as fascinating as I did, make sure to hit that like button and subscribe for more deep dives into the weird and wonderful stories from the past. Let me know in the comments what other historical events you'd like to see covered. See you next time.